now we will be discussing about other category of drugs for hypertension. We will be discussing about angiotensin converting enzyme inhibitors. These angiotensin converting enzymes are the first class of drugs or very important drugs in the treatment of hypertension. So generally when there is acute hypertension, we could use diuretic derivatives. But in serious cases or whenever a patient is having chronic hypertension, in that cases we can give ACE inhibitors. These drugs are the first choice or the main choice of drugs that can be given alone for the treatment of hypertension. When I am saying about ACE inhibitors, angiotensin converting enzyme inhibitors, these drugs will be targeting the angiotensin converting enzyme. So when we are talking about this, you need to understand the pathway or the production of angiotensin derivatives. So whenever there is reduction or when there is sodium water retention which is happening, which may result in low output or low urinary output, this triggers the release of renin. Renin will further stimulate the synthesis of angiotensinogen, which may lead to the flow of production of angiotensin 1. So now this angiotensin 1 is a polypeptide which can be converted into angiotensin 2. So now students, just remember this main path where angiotensin 1 is converted into angiotensin 2. So our enzyme, that is angiotensin converting enzyme, mainly acts at the region or it is available during the conversion of angiotensin 1 to angiotensin 2. So since angiotensin 2 is a very powerful vasoconstrictor, it causes constriction of the blood vessels which may result in the increase in the blood pressure. To control this and to subside the increased blood pressure, our target here is to inhibit this angiotensin converting enzyme so that there won't be any further conversion of angiotensin 1 to angiotensin 2. So this angiotensin 1 to 2 conversion is directly blocked by ACE inhibitors. However, this enzyme conversion can be immediately modified or after certain period of time. If angiotensin 2 is available, this may further result in the synthesis of aldosterone derivatives. So potentially our drug may target the inhibition of conversion of this enzyme. So certain drugs called as PRILs. Students, do remember these drugs short form is considered as PRILs, PRILs. Drugs like captopril, enalapril, esomeprazole, these drugs are mainly acting on the ACE or ACE enzyme. Okay, so you can easily remember the end point or ending of the name is considered to be as pril. So if you remember pril, no one can manipulate this. All the prils will be coming under ACE inhibitors. So let's moving forward. These ACE inhibitors have very wide range of use. They can be used in combination with diuretics or they can be used along with vasodilators. However, they have certain side effects. They may cause hypokalemia, and the most important side effects that is associated with the use of this drugs is, since they cause or they stimulate the release of bradykinin, when we use ACE inhibitors, they may result in production of excessive dry cough. Okay, so in these conditions, we can supplement the use of ACE inhibitors in the patients with other derivatives called as ARBs. So that means angiotensin receptor blockers. So this is the next category of drugs which are used in the treatment of hypertension. Angiotensin receptor blockers. So these drugs are called as SERTONs. SERTONs like candicerton, irbesartan, valsartan. So these drugs will be used to block or inhibit the angiotensin receptors. So specifically 81 receptors are blocked or they are targeted for the reduction of the hypertension. So if at all in certain categories, if we could not use drugs which are targeting ACE enzyme, in those cases we can give this. That means patients who are having chronic hypertension, in those cases we can give this ARBs. angiotensin receptor blockers. They directly block the receptors, thereby there won't be further synthesis of angiotensin and there won't be further vasoconstriction. That means these drugs directly block the formation of vasoconstriction in the blood vessels. So these drugs are carried forward. They can be used in combination therapy or they can be used in monotherapy along with the diuretics. So we can use all this in the combination therapies majorly along with certain other drugs.